start a recording. I am Sister Bennell, and I worked in the Women, Infants, and Children program for 13 years. And so this topic this week is one that I really enjoy. I really enjoyed teaching pregnant women and working with the babies and the children. So we're going to look at nutrition recommendations for that population. And there are some other instructors with me here tonight to help keep track of any questions you put in the chat box. So being pregnant and breastfeeding your baby are both unique life experiences. Participating in the creation to bring spirits to this life is special work that women need to prepare her body for. President Russell M. Nelson said, "During my professional career as a doctor of medicine, I was occasionally asked why I chose to do that difficult work. I responded with my opinion that the highest and noblest work in this life is that of a mother. Since that option was not available to me, I thought that caring for the sick might come close. I tried to care for my patients as compassionately and competently as mother cared for me." I also like what Sherry Dew said in this talk. I have the quote on the slide there, but she also said that women are all mothers. We're mothers by protecting motherhood, by being nurturing, and by helping to educate others. So here are the weight gain recommendations. This is for a pregnancy with one baby. If having twins or multiples, the recommendation would be different. So looking at this, answer in the chat box. If a woman had a BMI of 24, how much weight should she gain during her pregnancy? You've got it. Yep, 25 to 35 pounds, because a BMI of 24 is within the normal weight category. Gaining more than the recommended amount of weight during pregnancy is associated with having a baby who is born too large, which could lead to delivery complications, a cesarean delivery, or obesity for the child later in childhood. Gaining more than the recommended amount of weight can also increase the amount of weight you hold on to after the pregnancy, which can lead the mother to obesity. There are problems with gaining too little weight too. It could result in a baby who is low birth weight. And if there's no other complications, low birth weight babies can catch up their growth. However, later in life, they're more likely to develop diabetes, obesity, high blood pressure, and heart problems. So the weight gain during pregnancy does matter. So along with weight gain, you need to look at the energy needs of the mother during her pregnancy. During the first trimester, there's no additional calories needed. And then the second trimester, it's an additional 340 calories. And the third trimester is an additional 452. That's not like a lot of calories, that's just a bit. And there's a page in the textbook that has some examples of how much food that actually would look like. The increased calories help the mother's organs, such as the uterus, breast tissue, and placenta. The placenta is an organ that develops in the uterus. Its role is to deliver nutrients and oxygen to the baby and remove waste products from the baby's blood. The carbohydrate RDA is the minimum amount recommended. It's the 175 grams. That's just what is needed minimally. Most people would need more than that. And then the protein needs, the first trimester, there's no increase in the number of grams needed. And the second and third trimester both need 25 more grams of protein per day. So someone's asking, is that the same as the kcal, or do we have to calculate that? So the questions I've seen, it will say, this is this person's energy needs, And if they're this far along in their pregnancy, how much more calories do they need? So you would need to know when the different trimesters are, and then you would need to know, oh, that time frame is the second trimester, add just the 340 onto the number it gave you, or if it was a third trimester, add 452 onto the number it gave you, or first, then you know they don't need any additional calories. And in the DRI chart, in the resource document, it will tell you, it will remind you that the second trimester is additional 340 and third is 452 and first is no increase. The protein requirement, so first trimester, 0 grams increase, second trimester, 25 gram increase, third trimester, 25 gram increase. I know the book does say 450, the DRI chart says 452. So I made my slide match the DRI chart. Good questions. Okay, physical activity. Physical activity is recommended during pregnancy unless there's a medical reason not to. If you weren't exercising before your pregnancy started, then you'll want to gradually increase up to this recommended time. Moderate intensity exercise is what raises your heart rate and you break a sweat. You can talk, but you can't sing, is how that is defined. And it's generally recommended that pregnant women do not do any activities that could increase the risk of falling or that could cause an injury, like soccer or football or any other contact sports or horseback riding or downhill skiing. They shouldn't jump or change direction quickly or lie flat on their back after the first trimester. So physical activity is going to help keep hormones more stable, and it's going to help reduce the risk of excessive weight gain, which can decrease the risk of gestational diabetes during the pregnancy. And physical activity increases the cardiorespiratory fitness without increasing negative risks like low birth weight, preterm delivery, or early pregnancy loss. And then exercising in the postpartum period helps to improve cardiorespiratory fitness and decrease symptoms of postpartum depression. And when it's combined with calorie restriction, it can help the woman return to pre-pregnancy body weight after delivery. What about additional calorie recommendation during each trimester for seafood? So the seafood recommendation is 12 ounces a week, and to avoid fish high in mercury. I don't know how that goes along with calorie recommendations. So let me know, Lisa, what else you meant by that. Okay, there are several things that can be concerning during pregnancy that are related to nutrition too. And these are because of the fluctuating hormones. Constipation, heartburn, morning sickness, nausea, possibly vomiting, food cravings, different food aversions, gestational diabetes, gestational hypertension. Let's look a little more at these. So there are some things that can help. Constipation, you want to make sure you're drinking plenty of fluids, having good hydration level helps move things along, and include physical activity. Like I mentioned, physical activity helps to regulate those hormones a bit, and physical activity also just helps keep the GI tract moving. And we want to make sure we're eating plenty of foods with fiber, like whole grains and fruits and vegetables. And then with heartburn, need to reduce high fat foods, caffeine, or any other trigger foods, probably like spicy foods. And we want to eat small, frequent meals. We don't want the stomach too full because that puts pressure that can contribute to that heartburn. And then drink fluids separate from meals so that the stomach is not too full, and don't lie down for 3 hours after eating. The morning sickness can be all day sickness. It's not always just the morning, unfortunately. And again, for this, small frequent meals seem to help, and to include physical activity, avoid trigger foods, anything that just makes you feel sick to your stomach, avoid strong or unusual odors, get some fresh air. Some ginger can help, or ginger ale, has to be real ginger ale. And sometimes you need medication just to take the edge off the nausea. So that's something that, of course, the doctor would prescribe. The small frequent meals, I think, is really important to remember. Okay. This slide has our bonus word on it. I'll tell you that in a couple minutes. Just want you to be ready. So prenatal vitamins are recommended during pregnancy. Folate or folic acid. Folate is the name of the naturally occurring vitamin, and folic acid is what we call it when it's in synthetic form. We need that before pregnancy and in the beginning of the pregnancy. A deficiency in folate prior to pregnancy could cause birth defects to the brain and spinal cord, like spina bifida. 600 micrograms a day is what's needed before pregnancy and during the entire pregnancy, actually. And then iron is another one that the needs increase. The recommendation is 27 milligrams, and that can be really hard to get just from your diet. The iron needs are increased because your blood volume increases while you're pregnant. So we want foods with heme iron. Remember, heme iron is absorbed easier. So in 3 ounces, that's the MyPlate recommended serving size. So 3 ounces of beef, there's 2.2 milligrams of iron. So you would need just over 12 servings of beef to get up to the 27 milligrams of iron. So you're probably not going to eat that much food to get your iron. Some non-heme iron sources, examples would be like beans and fortified cereals, fortified grains, pastas, and their absorption is increased when eaten with foods with vitamin C or heme iron. Vitamin A, excessive intake of vitamin A can cause birth defects. That's not likely to happen from eating food. It's more likely you're getting excessive vitamin A from supplements or from medications like the acne medication Accutane. So you have to stop taking that before pregnancy. And then contraindicated or teratogens, things that would cause birth defects, could be alcohol, smoking, marijuana, some over-the-counter medications, and prescriptions. The dietary guidelines say that women that are or that may become pregnant should not drink alcohol at all. Alcohol is related to learning problems and other problems, fetal alcohol spectrum disorders. So that you want to avoid that completely. Okay, the bonus word, ready to write this down? It's teratogen, right there at the bottom of the slide. I'll spell it, T-E-R-A-T-O-G-E-N. Remember, please don't put it in the chat, but make sure you do write it down so you put it in your assignment and get your bonus points. Teratogen, T-E-R-A-T-O-G-E-N. Okay, food safety. I mentioned this briefly. We want fish lowest in mercury, like salmon, tilapia, and pollock, and avoid any of the large fish that have more mercury. And we want to avoid raw sushi because of food safety concerns. Heat leftovers and deli meats, avoid unpasteurized products or cheeses that are made from raw milk, and avoid sprouts. It's easier to get foodborne illness during pregnancy, so it's important to practice food safety, like washing your hands, cooking to proper temperatures. And we do want pregnant women to eat fish, a variety of fish, 8 to 12 ounces a week. That helps them to get omega-3 fatty acids, and DHA, and those both support baby's brain and eye development. Sprouts are just known to be a food that can cause foodborne illness very easily. Okay, moving on to lactation. There are a couple of hormones that are important for you to know about. The first there is oxytocin. It's responsible for triggering the letdown reflex. Letdown is the involuntary release of milk from the milk producing glands and its movement through the ducts through the nipple. Some women can literally feel the milk let down. Others don't feel anything at all. Both ways is normal. Oxytocin has also been called the hug hormone, and it's linked to warm feelings that can lower stress and anxiety, and it helps to promote the bonding feelings that mother and child have. And then the next hormone is prolactin, and it's responsible for stimulating milk production. It helps to initiate and maintain the milk production the entire time you're lactating. And then some nutrition recommendations during breastfeeding. For the first 6 months, you need 330 more calories per day, and then 400 calories beyond 6 months. So if you breastfeed longer, you actually need more calories, and you need more water, and almost all the vitamins and minerals increase, and you continue to need 25 more grams of protein per day. And just a little side fact about breast milk: if you pump it, you shouldn't vigorously shake it after you warm it, because that will denature the proteins. You should just swirl it around to mix it up. And this is just some advice to help get breastfeeding off to a good start. Yes, the extra 25 grams of protein is during the entire time you're breastfeeding. Breastfeed or pump, that should be initiated within an hour after giving birth. And just know that your mature milk comes in 2 to 5 days. The first milk is called colostrum, and it can be different colors. The color comes from the beta carotene in it, and it comes in small amounts, but that's perfect. A newborn's stomach is very small, and the breast will be softer and easier to practice latching those first couple of days until the mature milk comes in and the breasts are more full. Breastfeed whenever your baby wants to. That's sometimes called on-demand feeding. And babies typically need to breastfeed every 2 to 3 hours or 8 to 12 times a day. So it is a lot of work to have a baby, a newborn. I read this quote somewhere, and it's just, I think it's absolutely true. As a mother, the days are long. Like sometimes they seem to never end. There's so much for you to do, but the years really do fly by. Just try to keep some perspective. You have a newborn for a month, you have an infant for 11 months after that, and then you have a toddler, and then a child, a preschooler, and then a kindergartner, and then before you know it, they're graduating high school and moving out of your house. So it's fun. Okay, time to chat. Time to type in the chat box what you know. I'm sure you've heard lots of breastfeeding benefits, so I want to hear what you know. Baby bonding, it's cheap. Immune support, baby immune system. Let's tighten the uterus, better digestion for baby. Love, nourishing. You're also smart. Okay, let's see what we have on the slide. So improved immune system and healthy gut bacteria. It lowers the incidence of respiratory diseases, gastrointestinal problems, and diarrhea, ear infections, asthma and allergies, and SIDS, which is sudden infant death syndrome. The long-term effects, it may lower the risk of type 1 and type 2 diabetes, celiac disease, and obesity. There's bonding. You can bond without breastfeeding. Breastfeeding is wonderful bonding. And then for the mother, there's benefits too. Strong bones reduces the risk for breast and ovarian cancer and type 2 diabetes. These are all evidence-based breastfeeding benefits. And it's wonderful, but it can also be challenging. It's a new experience for you, for your body, for your baby. Everyone's learning. It's really important to be patient and get support and know that it can get better. You're someone that struggles, and you just do the best you can and get support. Talk to a person trained in lactation. Others can give emotional support, but their advice might not be correct. So I just always recommend talking to an actual lactation expert. I got some bad advice from my OBGYN. I don't need to tell that story, but I did. Okay. And there are some reasons that you can't breastfeed. HIV is contraindicated in the USA. In other countries, women still do breastfeed when they have HIV, and the baby doesn't necessarily get it. Women undergoing radiation or chemotherapy are not able to breastfeed. An infant diagnosed with galactosemia, that's a rare inherited disorder that impairs the body's ability to process galactose, and they have to go on a special formula. And then a mother taking illicit drugs, she should not be breastfeeding either. Okay, some more specifics about infant nutrition. So from birth to 6 months, all they need at all is breast milk or formula. They don't need extra water or any food at all. And then about 6 months, when the infant's able to physically ready to start solid foods, when they can sit up with some back support and they're big enough, and they're usually about double in their birth weight, then you introduce solid foods one at a time. And you want to do one at a time so you catch any allergies they may have, and so that you can slowly progress to different textures. And we want to make sure we start including iron-rich foods. The iron stores that the baby was born with are about gone by this time, and they really need some iron-rich foods so that they don't get iron deficiency anemia. And some of the common allergens are eggs, milk, and peanuts. They're the most common causes of food allergies in children, with wheat, soy, and tree nuts also included. Peanuts, tree nuts, fish, and shellfish commonly cause the most severe reactions. Signs of allergy are runny nose, intestinal pain, and itchy skin. And then by 9 to 12 months, we're progressing the texture more, and we're starting a cup so that they'll be able to transition from the bottle at age 1 to a cup. We want to learn a cup. It's really great. It helps them develop different muscles in their mouth so that they develop speech. And we also want to protect their teeth. They stay on a bottle, they're more likely to damage their teeth. And I was just going to ask for you to put in the chat box why infants can't have honey, but you beat us to it. Yes, it's because of the risk of botulism. So no honey for infants at all. No honey, no foods made with honey. And we also want to be careful of any choking hazards. That'd be things like grapes, raw carrots, and apples, or other hard, raw fruits and vegetables, raisins, hard candies, or sticky foods like too much peanut butter, or any foods with skins. Breast milk can be continued after age 1. That's up to mom and baby. They can breastfeed as long as they would like to. Or whole milk is recommended unless the baby is over the 95th percentile on the growth chart. And we'll be looking at growth charts later. Then they would, 2% would probably be recommended by the pediatrician. So someone's asking about different cups. There are sippy cups that are kind of similar to bottles. So I get it. That's a little different than a bottle. Maybe gives them a little bit different thing to try. And it's definitely less messy for the parents, for the baby. But they really do sometimes need to use just an open cup because different mouth and tongue muscles are going to be worked out by using just a regular open cup. So of course you don't want to fill it up full. You'll just put a little tiny bit in the cup and let your baby practice with it. They'll take little sips, or if they get a big sip, at least it's only a little bit in the cup. So it doesn't make too much of a mess when it comes back out. And yeah, it helps wash their mouth, their face, and they practice. And again, it's something fun. Couple more things about infants. Breast milk is low in vitamin D, so supplementation may be needed for vitamin D. Keep that in mind. And iron, breast milk is a poor source of iron, but the iron that's in the breast milk is very bioavailable. So that's great. They keep breastfeeding that whole year, but by 6 months, yes, we want some pureed meats and some smashed beans, and anything else that has iron, the fortified cereals. Baby definitely needs those so that they don't become iron deficient.
Sister Bunna,
Yes.
there was a question a little bit earlier.
Oh, maybe I missed it in the chat. Let me scroll up.
Well, and I don't know that I have the perfect answer, but what are some reasons why women can't make enough milk? She says she could only nurse
Okay.
a couple weeks.
Lots of reasons. Very often it's just because breastfeeding didn't get off to a good start. Like those first 4 to 6 weeks are really, really important to teach your body to lay down the receptors needed to tell your breast to keep making more milk. Like if it's not used, it will disappear. So that's why it's so important to start breastfeeding or pumping and keep it up so that you establish a good milk supply. But there's other reasons like PCOS or other disorders that it just doesn't work out for a woman to have a full milk supply, but some is always better than none. Someone was saying tongue tie. Yes, tongue tie in the baby. They may not be like latching on and emptying the breast all the way. So you have to watch for signs in your baby that they are being fed well. And if there's problems like that, yeah, you want to work with a lactation consultant and your pediatrician to make sure the baby is having enough wet and messy diapers so that you know that they're being fed well and that they're growing how they're supposed to be. And if they're not, then maybe you need to pump after you feed or do some other things. Sorry about the dog. There's lots of reasons, but there's a few. Hopefully that partially answers your question, but really it's an individualized thing. You'd have to be assessed by a lactation consultant. Stress, yes, Sister Bobkin. Stress can make a difference in how our body responds to breastfeeding too. A premature baby, that's a good one too. Like you can do it, and that milk is so important. The milk will actually be different and better for your baby when they're premature. It's like your body knows what it needs to make for your baby, but your body's also stressed because you're like, oh, I had this baby early. So yeah, you just try to relax and get a really good pump and hold your baby skin to skin a lot, because that will help you produce better milk too. And there's other tricks, but yeah, you need an assessment and help from a lactation consultant if you're struggling with milk supply. Okay, On to kiddos, child nutrition, division of responsibility in feeding. Missing the page. Sorry, I've got notes. You can tell I'm reading my notes over here. So division of feeding responsibility is Ellen Satter. She was a social worker and a dietitian, and she came up with this feeding. And we have a great assignment on it. And I recommend you do the assignment before you take the exam too, because it should help you. Okay, so there are some jobs. So the parents decide, and in the assignment that's related to stewardship, because we're having you compare this to the proclamation on the family. So parents decide it's their stewardship, what, when, and where. So what is to include foods that they know their child likes, and only 1 or 2 new foods. Don't overwhelm your kid with everything new. There should be at least one thing familiar for them to choose to eat from. And then when, meal and snack times allow children to become hungry and more willing to try new foods. So you don't want them just like grazing and eating all the time. So babies, you follow their schedule, and toddlers, you need to be more flexible too, because they're transitioning from baby to child, and they may need more snacks, but they still shouldn't be grazing. Like we want the child to actually be hungry for the meal or snack. So the parent decides when they eat, and then where you want to avoid distractions and eat with your child. I know it's really, really tempting to just like stick them in their high chair with their food and then go do something that you need to do for a minute. They learn, you're modeling how to eat. You need to sit down with them, and it's a time to have conversation and learn with them. Okay, so that's the parents' jobs. And then the child decides how much they eat and whether they're going to eat or not. And food jags are very common, especially with small children. A food jag is when they want to eat the same thing over and over and over again. It could last for days, weeks, and sometimes even months. And then another note with, I want you guys to answer in the chat. How many times can it take offering a new food before a child will accept it and eat it? Yep, exactly. 8 to 10. You guys knew that. And that has to be like the same thing. Like there's lots of ways to offer, I don't know, say like a potato. Like a baked potato is not the same as fries or scalloped potatoes or whatever. Like if you want them to learn to eat baked potatoes, that has to be offered 8 to 10 times. So just keep that in mind. Be patient. Keep eating it in front of them, and maybe if they see you eat it, they'll eat it. With some of my kids, there were some things that they weren't interested in eating until they went to school and they saw kids at school eating it, and then they were okay with eating it even though they had seen me eat it. So it just, be patient, and keep trying, keep offering over and over again. Some other points to keep in mind: by age 6, a child has pretty much established their eating habits that they may carry into adulthood. So offer a big variety right from the start, but don't force them to eat. That's not recommended. We don't want them to feel traumatized. And encourage them and keep being the positive role model, like I already said. And then some more notes with drinks, beverages. 2 cups of dairy a day is what's recommended for children. Excessive consumption may decrease appetite. But I know my work in Wicca, I also saw that there were some kids that could drink a lot of milk and still eat a lot of food. And so sometimes that was contributing to them growing too fast and gaining too much weight. Or the kids that were too small, too underweight, it was because all they wanted to do was drink milk and they weren't getting all the nutrition they needed because they weren't eating enough food. So what I would always say is milk with meals and water any other time your child is hungry. Another possible problem is iron deficiency anemia can be common with excessive milk intake. The iron and the calcium compete with each other to be absorbed in the body. So when we've got calcium super, super high, that may be pushing some of the iron away from being absorbed. And then with juice, the recommendations say not to give juice at all before age 1, and then only 4 ounces a day, just a little half cup. And this you shouldn't put in a sippy cup because you don't want them sipping that over and over and over again. Even when it's natural sugar, that's still not good for the teeth to have over and over again. We don't want to contribute to any baby bottle tooth decay. That's also called early childhood caries. And then the growth chart. So this is the BMI growth chart for ages 2 to 20. A BMI at or below the 5th percentile is considered underweight. The 6th to the 84.9 percentile is the healthy or normal weight range. Then the 85th percentile to 94.9 is considered overweight. And the 95th and above is considered obese. So let's think about what this means. So if you had a 3-year-old and they were plotting on the 80th percentile, that is in the healthy weight range. But to think of that compared to other 3-year-olds, there would be 80 children the same age that are less heavy, and there would be like 20 children more heavy than the one on the 80th percentile. So out of 100 kids the same age, they're above or below wherever that child's plotting. Any other questions about the growth chart and how that works? Because the BMI on here and the growth chart for babies and kids is a little different than BMI for adults. Okay. I feel like I really flew through that really fast. So make sure you do the review that's in the module for weeks 11, 12, and 13. That'll help you. The exam is due Saturday. And here are some of the main points from week 11. Know the risks associated with high body fat. Know the BMI classifications and the strengths and weaknesses of using BMI as a measurement. Understand energy expenditure, basal metabolism, non-exercise activity, thermogenesis, thermic effect of food, how energy is stored in the body, how energy needs are estimated, hormones that regulate how much we eat. Remember the leptin, ghrelin. Week 12 is about managing weight, who benefits from weight loss. Remember that 1 pound of fat is about 3,500 calories. Know how quickly you should lose weight, or it's like 1 to 2 pounds a week. What makes a good weight management plan, the pros and cons of weight loss drugs and supplements, pros and cons of weight loss surgery, who's eligible for weight loss surgery, the 4 components of fitness, benefits of exercise, and then the weight gain recommendations during pregnancy, the physical activity recommendations during pregnancy, recommendations for nausea and heartburn, nutrient needs for pregnancy and lactation, the dangers of alcohol and drug use, benefits of breastfeeding, understand the growth charts that use BMI percentiles, how that's different than just BMI, how to support healthy eating habits in children. You want me to go back to week 12? This is definitely in the review study guide. So then your final exam will open this Friday, the 15th, and you have until July 20th to take it. So it's a Wednesday, that's different. Don't think that you have until the next Saturday. You don't, you only have till Wednesday. It covers the entire class content and their case study type questions. There's going to be 25 questions worth 4 points each. Okay, in the study guide, it asks, compare the bioavailability of iron in breast milk and infant formula. Is the answer it is greater in breast milk? Yes, you got it. There is no teacher review next week. This is it. This is the end. Can you believe it? Yes, I was going to pull up the resource guide for you. Let me stop the share and then find the resource document. I thought I had it right here. Sorry, guys. I need to get out of my PowerPoint. And the show. Okay. Here's the resource document for exam 4. So here's the DRI tables. Like I was saying, here is the energy requirements during pregnancy. So you can see first trimester, it's just the EER, or the estimated energy requirement, her normal calorie requirement plus 0. Second trimester plus 340. Third trimester plus 452. And then you can see there's lactation. We've got the physical activity stuff. I didn't see that you were doing any EER calculations in the exam, but you do need to know like this information, right? And then the DRI tables for the vitamins, minerals, and here are the BMI categories, and it goes over adults and children. And remember the ABCs of behavior modification, that's in your resource guide here. Here's the recommended weight gains during pregnancy. And here's some recommendations from the American Academy of Pediatrics for juice. And that's the resource documents. And you can also look at this when you do your review study guide. You're able to see the resource document that you will have for the exam. Okay, let's see, guys. Okay, Sister Balkan answered those questions. What else, guys? Yes, I think there's a resource guide for the final. I didn't download that one. So the final is 25 questions, and they're like a case study style. So I don't think it's broken up for number of questions per chapter. It covers everything you've learned the whole semester. So yeah, Sister Balkan is double checking the resource document for the final, because there was a question about the DRI charts, whether they're included. The final exam is closed booked and proctored. And I thought we had a review for that too.
It's there. This is the document. Here's the DRI tables. So maybe Diego, double check where you're downloading. But I downloaded this, oops, just from the review.
Hi, Sister Botkin.
Oh, that's
Yes.
exam 4 again.
That's exam 4. Yeah, we want to look at the
Correct.
final.
Great. Double check. But I pulled up the right one.
I'm going in to check the modules here. So I thought I saw. Yes, there's definitely.
It's not there. And I'm trying to read, maybe I'm gonna have to go look at the final. Maybe you don't have to use the DRI tables. I thought we did, but I can show you. This is the,
No, I know I skimmed through the questions, but I kind of can't remember them right now.
we will double check.
Yeah.
If you need it,
There's
it will be
definitely
added.
an exam study guide here.
Oh, you know why it may not be given to you?
Okay, you guys had it?
Whoops, the questions are all related to this specific case study.
Yeah, so I don't know if they
And-
need to look up any DRIs for it.
Her DRIs are listed in the nutrition calc reports, if you can see that. So that is why they probably didn't include it, because you're only going to use them for this specific person. And so they're there. Does that help? But make sure you know how to use the different graphs and reports from Nutrition Calc, because you'll obviously, you can see you're given this. Is this already, I'm assuming it's not technically available yet, but you got to kind of see it briefly. So.
Yeah, that
Oh, I
opens
guess
on
Diego,
Friday.
Diego was able to open it. So he already, it is available. And say, I thought it was available. If Diego was able to open it, it's there. So you
For
can go and look.
The
and figure
study
out
guide
the-
review, yeah.
Yeah.
Okay.
So
Okay, Lisa wanted us to do. My chat keeps moving here. Can you review the energy balance principle and how weight gain or loss is computed? Is there another instructor here good at that?
Sorry, what was it that she wanted to review?
Can you review the energy balance principle and how weight gain or loss is computed?
Yes. So energy balance, if you remember, there's positive, negative, just neutral. If you're in positive energy balance, you're usually gaining weight. So we see that happen a lot of times
During
in
pregnancy.
women when they're pregnant. Or like an athlete that's trying to gain muscle will sometimes be in that positive energy balance. And then negative is seen oftentimes in the elderly when they're just not eating enough, or someone with cancer, they're going to be losing more of their weight. So does that help? So it's just positive. If you're eating more than you're using, you're going to gain weight. In some cases, it's muscle weight. And negative, if you're not using as much calories, or if you're, excuse me, I said that wrong. Did I say that right? If you're using more than you're consuming, then you would be in negative and you'd be losing. Hopefully I didn't confuse people more. No, there's not a calculation, at least not that you would be needing to use in this class.
So two populations that are in negative energy balance would be a burn victim. They're using so many calories trying to heal, and you can't get enough energy, enough protein. And the other one is a lot of times the elderly, they just don't eat enough calories, and so they're in negative balance.
Just a few reminders about the exam. The Proctorio calculator and one blank piece of scratch paper are allowed during the exam. And there's no code for Proctorio. If you get a prompt for a code, then you should try uninstalling Proctorio and reinstalling it. If you still have problems, then you need to contact BYUI tech support or Proctorio line given in the exam instructions. And everyone has to be proctored. There's no exceptions on that. If you have any other questions, then reach out to your specific instructor. I'm going to stop the recording.